So we are going to be talking about urinalysis. Urinalysis. So when you hear the word urinalysis, what comes to mind? Urine and analysis combined together. Of course, we know that urine is what? Is being produced by the body freely without stress. Yes. So as long as one is a human being and the person is a living thing, you know, you expect that the body should be able to what? Produce urine, because we drink water, we take in water from the atmosphere. So definitely it is whatever that garbages in that is supposed to be garbaged out. So urine analysis is analysis of that waste product, which is urine, that we human beings normally pass out without paying for it. Do you pay for it? No. So that urine that you pass out can tell a lot about one's health. There are some things that may be happening to the body that ordinarily probably one wouldn't have known, except when it starts showing symptoms, signs and symptoms, or when the disease has become a full blown. So, but from the normal urinalysis, it's a screening test. That's why it's a screening test. So from that screening test that one is supposed to be doing from time to time, one will be able to know if there are some certain things that are going on in the body that one wouldn't have detected until it has become something else. So like I said, urinalysis is a diagnostic test. It's a screening test. It analyzes the different elements of urine. That urine you are passing out has some certain things in it. There are some that are normal and some which are not supposed to be found or seen in the urine. So it's a diagnostic test that analyzes different elements of urine, shedding light on overall health and potential health concerns. So we're going to be looking at the components of urinalysis. But before then, make it a point of duty or importance to always go for urinalysis. Though simple, it looks simple, but it is highly informative. Okay, let's go ahead. So when we are doing urinalysis, what do we look at? So we look at the macroscopic aspect of the urine. One of the things you look at is the color. Urine has its peculiar color. So most time we say amber. So from light yellow to dark amber. Urine color might reveal hydration status or any underlying health problems. So from light yellow to dark amber, not very dark though. So by the time you start seeing somebody producing urine that is bloody, probably it is not from a female. Or even if it's from a female, the person is not menstruating. And how come the urine is looking bloody? So that means something is wrong. So we look at the color and we also look at the appearance. We look at the color and we look at the appearance. So those are the macroscopic aspects. Appearance, is it clear? Is it turbid? Is it cloudy? Urine is supposed to be clear. It's supposed to have that light yellow to amber color, and it should be clear. But when you now start seeing a cloudy or a turbid urine, that means probably there is a problem somewhere, or it could be as a result of one thing or the other. So that's why we say it's a pointer to one's health or underlying conditions. So when we now move from the macroscopic aspect, we now go to the chemical components of urine. So there is this dipstick. It's a container. Some are could be 10, some could be 9, some could be 3, 2, etc. Yes. So pregnant women in their clinics, most times you see could be 2, could be 3 there. The one that has just glucose, protein in it, maybe some will not have pH. Okay. So I'm going to be looking at some chemical components of urine. So the first one I have here, look at pH level. Urine pH gauges acidity or alkalinity and can reveal information about kidney and urinary health. So urine has its own normal pH. Anything outside that pH is something else. So it's not to be acidic or too alkaline. So If it's on either part of the pH scale, that means there's a problem somewhere. So the next one we are looking at is specific gravity. Specific gravity. Now, specific gravity assesses urine concentration, reflecting kidney function and hydration status. So urine also has its own normal specific gravity. Anything outside that normal specific gravity means there's a cause for concern. The next component, chemical component we are looking at is protein. Now, finding protein in urine may be an indication of diabetes, hypertension, or kidney impairment. Diabetes, hypertension, or kidney impairment. So, of course, we can find protein maybe at trace level or 1+ in some pregnant women as a result of pregnancy. Yes. But for a normal person, somebody who is okay, not pregnant and healthy, ordinarily you're not supposed to be seeing protein in the urine. So protein in urine could be as a result of diabetes, it could be as a result of hypertension or kidney impairment. The next one we're going to be looking at, the fourth one here, chemical component, glucose. Glucose is not supposed to be found in urine. Of course, when one is hyperglycemic, when the glucose level exceeds its normal renal threshold, which is 180 mg/dl, it can appear in the urine. So it's not supposed to be in the urine. So high blood sugar levels may be suggested by the presence of glucose, pointing to diseases like diabetes or metabolic disorders. The next one I'm going to be looking at is ketones. Ketones in urine can indicate the breakdown of fat for energy, potentially associated with uncontrolled diabetes or fasting. So we're not supposed to see ketone in urine. So seeing ketone in urine can be probably the person is starving, probably the person is having dehydration. Yes. So it could be that the body is breaking down fat for energy instead of breaking down glycogen and converting it to what? To glucose for energy. Okay. So the next one is red and white blood cells, leukocytes. So when we start seeing hematuria, blood in urine, or pyuria, white blood cells, it may suggest infections, inflammation, or urinary tract disorders. Nitrites and leukocyte esteries. Number 7. The presence of nitrites and leukocyte esteries can point to urinary tract infections. So these are the chemical components that we can see in urine and give us a clue on someone's health. So urinalysis also has microscopic aspect of it. So but I'm streamlining it now to the macroscopic and the chemical aspect of urinalysis. In conclusion, urinalysis examines various urine constituents to reveal information about general health, urinary tract infections, renal problems, metabolic disorders, and other health concerns can be identified by knowing the importance of urine color, pH, specific gravity, protein, glucose, ketones, red and white blood cells, nitrites, leukocyte esteries, and the rest. Now, the findings of a urinalysis should be thoroughly analyzed and interpreted by a healthcare expert to ensure an accurate diagnosis and the most suitable course of action. Now, why did you say it must be thoroughly analyzed and interpreted by a healthcare professional who is an expert? Some people think urinalysis is simple. It looks simple, but it is not. Through urinalysis, if one is not careful, we can give out a result that could cause one to spend unnecessarily or that could cause the life of a person. Yes, I can remember there was a time someone I know very well was given a wrong result of urinalysis. The guy almost hit the road. He just called me and said that he wants to enter the road and kill himself. It's not for my intervention and God on our side. God knows what would have happened. So that is why, even if it looks simple, but it must be done, analyzed by an expert in that field, a medical lab scientist, so that to be sure of the result that is given out, because that result can be suitable. The result is supposed to be used, to assess the health state of the patient. Okay, we'll call it a day here. Bye.